Hi, I'm Jennifer Hughes, the owner and founder of Sage Minds Counseling in Wiley and Wichita Falls, Texas. I am a certified ketamine assisted EMDR psychotherapist, and I want to talk to you about that today. If you don't know what EMDR is, hit pause, hop on over on our website, take a look at that video, and then come back and join me. So, what is ketamine? Ketamine is a medication developed in the 1960s to be used as an anesthetic. It has rapidly gained attention for treating other disorders such as treatment resistant depression, PTSD, and other mental health conditions. Unlike traditional antidepressants that target serotonin and dopamine, ketamine is going to target the glutamate system, which shuts down the NMDA receptors in the brain. This is going to allow for a much more rapid healing process to take place, sometimes even within hours of the treatment. It's also going to allow for increased neuroplasticity in the brain, which is going to help the brain form new and healthier connections. There are several types of ketamine. You have your IV infusions. You also have Spravato, which is a nasal spray. And then there are lozenges, also known as trachees or troches. Any of these are helpful in their own way, but used in conjunction with EMDR, the therapeutic benefits are significantly enhanced. Ketamine has a neurobiological and subjective effect on the brain to help support and enhance what we're already doing in EMDR. Our brains are pretty powerful, and even the most skilled therapists sometimes have a hard time accessing the material that's stored pretty deep. And if we are able to access it, sometimes it just remains stuck and we're not able to move it. Ketamine removes most, if not all, of the roadblocks we encounter in the therapy session. It even softens the experience of reliving those traumatic memories in the few minutes that we have access to them. I've even seen clients move from being fearful or nervous of accessing those memories to showing compassion to themselves. So, what does ketamine assisted EMDR therapy look like at Sage Minds Counseling? You and I will meet for an intake, go over your history. We will do a thorough mental health history as well as medical history and see if you're a good candidate. During this time, we're also gauging to see if you and I are going to be a good fit because we're going to go pretty deep in this process. If after the intake we decide to move forward, we will meet for a few sessions to go over some EMDR basics, educate you on the process, continue digging into your history, and learning skills and resourcing if we see that it's needed. In the meantime, you will reach out to one of the providers that I partner with to schedule an intake with a psychiatric nurse practitioner or a psychiatrist to do a thorough intake and make sure that you are a candidate for the ketamine therapy. If you are a candidate, the prescriber is going to get with me to make sure that we're going to move forward in this process, and then they will prescribe you the ketamine in the form of lozenges. You and I will then resume our treatment together and determine how we're going to move forward. When you are ready to move into the ketamine assisted EMDR sessions, you're going to bring those lozenges with you to session and then we begin our work. More specifics about how the ketamine is administered and what that looks like will already be discussed with you in the sessions leading up to this one. The ketamine assisted EMDR protocol that I use, the prescriber prescribes an extremely low dose of ketamine, so low that you and I are talking just like I'm talking to you right now. The prescription is just enough to lower those roadblocks that we talked about earlier and allows us to access that material that is stored. Sessions are scheduled for 90 minutes, and in most cases, we can get through all the material we need to in one session. We can really cater it to your needs specifically. Typically, you are provided enough ketamine to get us through 6 sessions, although we may not need all of that. After a few sessions, we can reevaluate and see where you're at, and you may decide we don't need it to use any more ketamine. We may be able to move forward with traditional talk therapy or even non-ketamine assisted EMDR sessions. If you are interested in ketamine assisted EMDR, please reach out to our office to schedule an intake with me today. I look forward to hearing from you.